Welcome to the deep dive. Today we're taking a close look at colorectal cancer, CRC. It's a really urgent health topic, but often kind of misunderstood. Our goal here is to basically boil down a whole lot of research and data into the key things you need to know, especially how it's affecting Vietnam right now.
Yeah, and what's immediately striking is how this disease, historically seen as more of a Western problem, is shifting dramatically. Globally, CRC is already the third most diagnosed cancer and the second deadliest. The projections are, well, they're pretty sobering. We're talking potentially 3.2 million new cases, maybe 1.6 million deaths a year by 2040.
Wow, that's a huge jump. And it's not just numbers changing, it's the location, right? The shift towards low and middle income countries.
Exactly. It seems linked to lifestyle changes, more westernized diets, less activity perhaps, and often the healthcare systems in these countries are struggling to adapt quickly enough to these new challenges.
So what does that picture look like specifically in Vietnam?
Well, in Vietnam, it's now the fourth most common cancer. We see almost 17,000 new cases each year. And tragically, over 8,450 deaths. That gives this very high mortality to incidence ratio, around 50%.
50%, that's incredibly high. What's the main reason for that, especially when we hear so much about early detection being key?
It really comes down to late diagnosis for the most part. The data suggests something like 20 to 30% of patients in Vietnam are diagnosed only when the cancer is already spread, metastasized.
Okay.
And that's just worlds away from the prognosis if it's caught early. Like localized. The 5-year survival rate is over 90%.
Over 90%. That difference is stark. And there's another layer to this, isn't there? This kind of surprising trend globally. CRC isn't just an older person's disease anymore.
That's right. It's quite concerning. We're seeing rising incidences in people under 50. Some European studies showed, I think, a 7.4% annual increase in the 20 to 39 age group. That's significant. And Vietnam reflects this too. We're hearing about cases in patients as young as 21. Yeah, and often these younger patients also present at later stages.
Which really highlights a gap, doesn't it? If screening typically starts at 45 or 50, we're missing this growing group.
Precisely. It's a real challenge to the established guidelines.
But, okay, amidst these challenges, there's a really powerful point in the research. Most CRC takes a long time to develop, right? From these non-cancerous growths, polyps.
Absolutely. That's the crucial window. It often develops slowly, over years, from polyps. This gives us a real chance not just for early detection, but for actual prevention.
Prevention? How so?
Well, because more than half of CRC cases are linked to risk factors we can actually change. Modifiable risks. Think about diet. Lots of red and processed meat. Not enough fiber.
Yeah.
That's a big one. Also obesity, not moving enough, smoking, heavy alcohol use, even type 2 diabetes. These all play a role.
Right.
So screening becomes more than just finding cancer early. It's about finding and removing those polyps before they even have a chance to become cancerous.
That makes sense. So if we want to use that window, what are the main screening tools people should know about?
The gold standard is still colonoscopy. It gives doctors a direct look inside the colon, and they can remove polyps immediately. But yes, it's invasive, it requires bowel prep, it's more involved.
Okay. And the alternative, maybe something easier to access?
There's the FIT test, fecal immunochemical test. It's non-invasive, pretty cost-effective. You basically do it at home once a year. It looks for tiny amounts of blood in the stool, which could signal polyps or early cancer. If it's positive, then you'd need a follow-up colonoscopy to investigate.
Got it. So for someone average risk, when should they start thinking about this?
Current recommendations generally say start talking to your doctor about screening options from age 45. Maybe even earlier if you have, a family history or other high-risk factors.
Okay, 45. But putting this into practice in Vietnam seems to face some big hurdles.
It definitely does. We talked about late diagnosis. A lot of that is driven by low public awareness. People often wait until they have symptoms.
Which is usually too late for the best outcomes.
Exactly. Then there's the cost. A colonoscopy can range from 700,000 VND to over 3.5 million VND. That's a significant barrier for many people.
Yeah, absolutely.
Add to that maybe limited access to screening facilities, especially outside major cities. And crucially, Vietnam doesn't really have a large-scale, structured national screening program.
So the responsibility falls heavily on the individual.
Pretty much. It's up to individuals to be aware, to seek out screening, and often to pay for it themselves, which creates huge disparities. So look, colorectal cancer is definitely a major challenge, globally and certainly in Vietnam. There's no downplaying that. But the key takeaway, I think, is this unique opportunity for prevention and early detection. That window really exists. We know over half the cases relate to lifestyle factors you could influence. We know catching it early pushes survival rates over 90%. So maybe the question for everyone listening is, what's one small change you could realistically make this week to be more proactive about your own health? Or maybe, what conversation about screening could you start with people you care about?